name is Malaki Lingg. I'm the web editor at the Paisano, UTSA's independent student newspaper, and I'm speaking with
Juan Benitez, pronouns he, him, his. I'm the Chief Advancement Officer for Texas Health Action and the Kind Clinic.
Perfect, thank you. And then, of course, I was invited here to talk about the study done on PrEP. So it was found 35 to 40% of people stopped PrEP after initiation due to issues with insurance and homelessness. Could you speak about that?
Sure. So when it comes to kind of PrEP retention, an important thing to take a look at is that this is just one study, and there really is no standard for what exactly is a quote unquote good retention of patients who are on PrEP. So there's that to kind of begin with. What we can take away from that are anecdotally what we hear all the time from our patients at Kind Clinic and our patients who are going to Kind Clinic in San Antonio. So I think we can take a look at a bigger picture of the realities of navigating healthcare in Texas and why it is that Kind Clinic is one of those leading organizations who are specializing in providing access to PrEP for HIV prevention and specifically focusing on LGBTQIA plus communities. So we're now going on 4 years of having a Kind Clinic in San Antonio, and that was our first clinic outside of the Austin area, which is where Kind Clinic started. So we're coming up now on almost 4 years, and we've learned a lot about the best way to reach patients in San Antonio and the best way to keep patients in care to begin with. And when we take a look at PrEP and HIV prevention, it's also an important thing to take a look at where does San Antonio fall in the grand scheme of HIV care and HIV prevention and HIV transmissions in Texas. And when we look at San Antonio, we can take a look at some data from the Department of State Health Services, where San Antonio, what we call the San Antonio HSDA, which stands for HIV Service Delivery Area, it's third in the state when it comes to HIV transmission and people living with HIV. So not only are stories like this important, but it also paints a much bigger picture of why it is that we need to do the work that we do to begin with.
Awesome, thank you. And then on that, of course, San Antonio is a very important place to have a clinic like Kind Clinic. We recently ran a story discussing San Antonio's one of the most infected, for sexually transmitted diseases in the state. It's very high up there. And then alongside that, there was the case Braidwood versus Becerra, where a Christian company was fighting to get rid of access to preventative care like PrEP for immediate insurance coverage. Has that, either of those affected at all Kind Clinics operations?
I can't speak to the case in particular, but what I can speak to is just the ongoing challenges in navigating healthcare, not just as LGBTQ individuals, but broadly as just Texans in general and people of color, which make up a good number of people in San Antonio. We hear all the time from our patients, and we saw some of this in that study as well that you referenced, is that insurance is a huge barrier to care for people. In Texas is the #1 uninsured state in the country to begin with, and in Bexar County alone, we're looking at about 17% percentage points of people living in Bexar County and San Antonio don't have health insurance. And that drastically changes the healthcare experience that someone has and how they get care and how they stay in care to begin with. Now, when we look at PrEP and healthcare for LGBTQ individuals, what we've had to do as the Kind Clinic and why we've proven to be such a successful resource for the communities that we serve is that we put in the additional work of what it takes to remove all of those barriers to care for someone. We now provide care to 25,000 people across the entire state of Texas. And one of the departments that we have is our patient support services department. And that team specifically focuses on keeping those patients in care to begin with. It's where we remove barriers to care if you have insurance or you don't have insurance. We're able to provide financial assistance. That's where our PrEP retention team lives. Yeah, all of the things that you mentioned, it's just one example of the complexities that everyday people have to navigate. And some of the stuff that Kind Clinic has to tackle along the way too.
Perfect, thank you. And then alongside that, I know there are issues with gender affirming care in the state right now, or especially in the South. Texas passed Senate Bill 14, which prohibits physicians and licensed medical professionals from providing gender-affirming care to minors. And I know especially with what Kind Clinic does, there's a very high percentage or disproportionate percentage of homeless youth who are or identify as LGBTQ+. Has that affected the Kind Clinic at all?
Well, on the ban itself, we know that gender care is healthcare. Healthcare for trans people is healthcare. And from our end, we take a look at it as sexual health as well, where we are able to provide PrEP and HIV care to individuals who are trans. And when laws like this are passed, it does change people's perception of where can they access care to begin with. So if someone is trans, it's beyond just access to gender care. That does create some barriers to people in their comfort level in accessing healthcare, period, to begin with, including sexual health resources like PrEP or STI testing and treatment, because people don't feel necessarily safe in navigating not just trans care, as I mentioned, but any other additional type of care to begin with. It is, yes, it's an additional barrier, we should call it, to care.
Great. And then, of course, we've talked about PrEP. Could you describe a little more on what PrEP actually does for people who don't know for HIV or AIDS and HIV prevention?
Yep, so PrEP, it's an acronym. The much bigger term is pre-exposure prophylaxis. So it's a daily medication that someone can take that reduces their risk of contracting HIV by 99%. Now, we specifically focus on reaching LGBTQ individuals because we know those are the communities that are disproportionately impacted by HIV transmissions.
Perfect, thank you. And then with that, what does the Kind Clinic do to further push themselves out, like community outreach? Are there events that Kind Clinic goes to, like table at? Have they been on like UTSA's campus or anything?
We have actually, and even beyond outreach and the access to care, we also should take a look at the Kind Clinic in the context of healthcare, public health infrastructure. Period. When the Kind Clinic first started almost 10 years ago, we were the first in Central Texas to bring PrEP to Central Texas and make it free for folks as well. And along the way, over the almost 10 years now, a decade of providing these services, we've built an incredibly unique model for why it is that people want to turn to us in the first place, beyond just access to PrEP. It's now HIV care, it's gender care, it's walk-in STI testing and treatment that is culturally affirming and provides those affirming healthcare experiences that many LGBTQ individuals don't have to begin with, or they have had a bad experience and they had no idea that they could receive this kind of care from a provider. And that is why Kind Clinic is so uniquely important to people. And it's why we've scaled so tremendously over the last 10 years. We now have 2 clinics in Austin, 1 in San Antonio, 1 in Dallas. We have a telemedicine program, Telekind, that is in half the counties in the state. So I think it's important to take a look at the broader landscape of healthcare and where we fit into that equation and why it is that we are a backbone for so many LGBTQ individuals, because clinics like this and healthcare like this don't exist in a lot of places. Now, beyond getting someone into care, and how we get there is, of course, outreach to different communities, whether that's mobile testing or going out to different college campuses like UTSA. We also have to take a look at then the operations of the clinic. When someone comes in to begin with, what will it take to keep them in this care and reduce HIV transmissions? And that's where the patient support services department comes in. That is incredibly unique. That doesn't always exist in other healthcare environments. Now we have the Kind Patient Assistance Program that's all housed under that Patient Support Services Department that delivers over $1 million in assistance to Kind Clinic patients every single year across the state. And through that program, KPAP is where we're able to cover the cost of medications. We're able to offer insurance premium assistance for patients who get insurance through the Affordable Care Act, and they may have some financial challenges there. We're able to help you with your insurance premiums. We'll help you cover your lab work as well, and even counseling sessions for folks who are coming through the Waterloo Counseling Center, another one of our programs. So it's really a much bigger need beyond just getting someone this medication. It's what does it take to keep them in this kind of care. And unfortunately, financial challenges are a reality for so many people, especially LGBTQ individuals. And that is why KPAP is such a foundational program, and it's such a key piece to the model that we built as Kind Clinic.
Perfect, thank you. And then I know during that you mentioned how there are 2 locations in Austin, 1 here. Are there any plans or thoughts of opening a second clinic in San Antonio, since San Antonio, especially the wider metropolitan, is such a large population? We're the 7th largest city.
Yeah, that's a really good question. I do not have the answer to that just yet. Like I mentioned, we're just 4 years into San Antonio, but of course the growing demand there that we're seeing it in our clinics, but also virtually as well. When we take a look at healthcare and Kind clinics, let's also take a look at the fact that maybe not everyone can come into a clinic. That might be in some rural parts of San Antonio or the greater San Antonio area. Let's remind folks that you can access healthcare in different ways. And one of those ways is through telekind and virtual appointments via Kind Clinic.
Cool. And then on that, of course, there's a lot of gender affirming care, and then the preventative measures that Kind Clinic does in testing. Do they, does Kind Clinic have anything psychiatry or therapy related, or do they do referrals for that?
So so Kind Clinic is a part of a much bigger entity called Texas Health Action. And one of our programs is the Waterloo Counseling Center. Now, the Waterloo Counseling Center started in Austin. It was the first HIV and AIDS related organization to provide care, and specifically mental health care. It's actually celebrating 40 years of service. And now that it's part of the bigger umbrella under Texas Health Action, and now Kind Clinic, we are able to refer patients to specifically LGBTQ affirming mental health care providers as well. So yeah, appreciate that question. It's a good tie-in into Kind Clinic cares beyond just sexual health care. We know the mental health needs of the LGBT community as well.
Yes, perfect. Thank you. I don't know if I have any more questions. Is there anything you specifically want to bring up or talk about?
Let's see here. Yeah, I think an important takeaway is, again, what I mentioned, that it's an incredibly complicated healthcare system to navigate, period. It can be even more challenging in the state of Texas for individuals, not just because of politically what's happening, but also other additional challenges like folks who don't have health insurance or may have some financial challenges as well. It's important to know that there are resources out there, and Kind Clinic is one of those specific healthcare models that addresses those challenges along the way. For us, it's a matter of how do we get the most people we can into the care that we offer, and what will it take to keep them in care? And that's exactly what the Kind Patient Assistance Program does, and it's been such a reliable support system for a lot of our patients as well.
Perfect. Thank you so much. Thank you for meeting to talk with me.
Of course. Thank you.
Thanks for watching. Click the logo for more from the Paisano. Remember to like this video and subscribe to our channel for more exciting content.